Which type of lung cancer is strongly associated with smoking? Small cell carcinoma, adenocarcinoma, bronchoalveolar carcinoma, large cell carcinoma. The correct answer is option A, small cell carcinoma. Which gas commonly found in homes is the second leading cause of lung cancer? Methane, radon, carbon dioxide, nitrogen dioxide. The correct answer is option B, radon. The Allen test is used to assess which arteries? Radial and ulnar arteries, brachial and radial arteries, popliteal and tibial arteries, carotid and subclavian arteries. The correct answer is option A, radial and ulnar arteries. Which gland typically decreases in size and function with age and may eventually disappear? Thyroid gland, pituitary gland, thymus gland, adrenal gland. The correct answer is option C, thymus gland. What is the most common type of fracture in children? Spiral fracture, green stick fracture, simple fracture, transverse fracture. The correct answer is option B, green stick fracture. The plague sign is associated with which of the following diseases? Kwashiorkor, rickets, scurvy, pellagra. The correct answer is option A, Kwashiorkor. Prone positioning in ARDS, acute respiratory distress syndrome, is used to reduce cardiac output, improve oxygenation, decrease lung compliance, prevent aspiration. The correct answer is option B, improve oxygenation. How long are the patient legs elevated during the Trendelenburg test? 10 seconds, 30 seconds, 1 minute, 5 minutes. The correct answer is option B, 30 seconds. What is a collapsing pulse also known as? Water hammer pulse, pulsus paradoxus, bounding pulse, necrotic pulse. The correct answer is option A, water hammer pulse. What is the most common cause of acute respiratory distress syndrome ARDS? Pneumothorax, sepsis, asthma, pulmonary embolism. The correct answer is option B, sepsis. A CT scan of the head shows a collection of blood between the skull and dura mater. Which type of head injury does this finding suggest? Subdural hematoma, epidural hematoma, intracerebral hemorrhage, diffuse axonal injury. The correct answer is option B, epidural hematoma. What is the recommended position for the patient when inspecting the legs for varicose veins? Supine, standing, sitting, lying prone. The correct answer is option B, standing. When a patient reports they feel pins and needles in their hands, they are experiencing paralysis, paresthesia, dysphagia, dyspepsia. The correct answer is option B, paresthesia. Which type of bandage is commonly used for a head injury? Circular bandage, spiral bandage, recurrent bandage, triangular bandage. The correct answer is option D, triangular bandage. Which test should the nurse monitor for a patient receiving heparin therapy? Hemoglobin levels, platelet count, prothrombin time, activated partial thromboplastin time. The correct answer is option D, activated partial thromboplastin time. What is the most common agent responsible for causing diarrhea in children? Adenovirus, rotavirus, salmonella, norovirus. The correct answer is option B, rotavirus. Which surgical procedure involves removing an entire lobe of the lung? Pneumonectomy, lobectomy, sigmoidectomy, thoracotomy. The correct answer is option B, lobectomy. A positive Homan sign may indicate deep vein thrombosis, peripheral arterial disease, lymphedema, none of the above. The correct answer is option A, deep vein thrombosis. What is the purpose of using anti-embolism stockings in a post-operative patient? To increase circulation to the legs, to reduce pain in the legs, to prevent deep vein thrombosis, to improve range of motion. The correct answer is option C, to prevent deep vein thrombosis. What is the most important electrolyte in intracellular fluid? Sodium, calcium, potassium, chloride. The correct answer is option C, potassium. Which lung cancer subtype is most common in non-smokers? Squamous cell carcinoma, adenocarcinoma, small cell carcinoma, large cell carcinoma. The correct answer is option B, adenocarcinoma. Substance used to counteract poison is called analgesic, antidote, antibiotic, anesthetic. The correct answer is option B, antidote. When a nurse performs an assessment using a stethoscope, they are conducting palpation, conducting auscultation, performing inspection, performing percussion. The correct answer is option B, conducting auscultation. What is the development of an embryo outside the uterus called? Ectopic pregnancy, miscarriage, intrauterine pregnancy, gestational trophoblastic disease. The correct answer is option A, ectopic pregnancy. Which of the following findings suggest venous insufficiency? Hair loss on lower extremities, brown discoloration near the ankles, diminished pulses, cool extremities. The correct answer is option B, brown discoloration near the ankles. ARDS is characterized by which of the following? Obstructive airway disease, alveolar inflammation and damage, bronchial constriction, pulmonary embolism. The correct answer is option B, alveolar inflammation and damage. What is the most appropriate intervention for a patient with dyspnea? Administering pain medication, positioning the patient in a semi-fowler position, encouraging bed rest for the entire day, restricting fluid intake. The correct answer is option B, positioning the patient in a semi-fowler position.